So this is a timely question because at the beginning of the year, the African heads of state and government requested ALMA to produce a scorecard. Now the ALMA scorecard includes key metrics for financing, for policy, for coverage, for implementation and for impact. And the heads of state have requested this so they have a single place where they can look at how are they doing, where are they falling behind, how are they doing in relation to their neighbouring countries and to Africa as a whole, to learn success stories from the countries which are doing well, to help countries which are less successful to move to where the other countries are. And as we've been developing this scorecard, what we've found is there would be a number of indicators that we would really like to be using, but at the moment the data isn't reliable enough for us to use. So we're using in some ways proxy indicators, or indicators which tell us less about, for example, impact and coverage and more about financing of commodities, for example. So whilst rolling out this scorecard and collecting as much information as we have, we also want to work with key partners, and MMV is a key partner in this, to identify how can we actually get data on, for example, stockouts of ACTs and RDTs, on impact, on how many people are actually treated, how many people are actually tested, what the mortality is. This requires that we draw attention, for example, to the heads of state, that there is a requirement for strengthening of routine data monitoring and surveillance, and also from donor agencies that there are increased finances invested into the collection of this data, because we're reaching the point now where it's almost as important to have that data as it is to have the commodities. Without that data, we cannot tell where we're going, what we've achieved, and make real-time policy and programming decisions which can improve our performance.